I wanted to tell you a little bit first about Shore Trust and the work that we've been doing nationally and internationally actually. So Shore Trust started in the village of Shore, hence the name, down in Wiltshire back in 1982. And it was founded really to support a group of people with disabilities and health conditions who've been really struggling to get back into work. And over the course of the next kind of 20 years, it became known as one of the largest disability charities in the UK in terms of employability and employment support. And then back in 2012, just as I joined the organisation, there was a merger between Shore Trust that was operating pretty much across the UK in terms of work choice and Careers Development Group, which was operating more so around London and the South East. And predominantly work programme, prime in East London and significant subcontracts in Surrey, Sussex and Kent, Hampshire and the Isle of Wight and West London. So it was really bringing together two organisations, both with a charitable status and charitable heart, but in recognition that that one entity then needed more of a commercial mind in order to survive in what was fast becoming a more commercial world. So the organisations joined forces, and that really started a period of quite significant growth for the new Shore Trust. And it wasn't enough for us to be involved in the employability sector. It was really all about transforming people's lives for the better. And people who are accessing a whole range of different support services, we wanted to get involved in that. So through organic growth and through mergers and acquisitions, we've now created the Shore Trust Group, which is actually the 25th largest charity in the UK, with a turnover of around £250 million. And we deliver services across the employability sector, so work and health programme, which I'll talk to you about in a moment. We're the largest provider of work and health services for DWP. Also National Careers Service, specialist employability support, and new enterprise allowance contracts. And then outside of the employability space, we also operate justice services, so the largest provider now of HMPPS CFO3, surprised I could say that, in addition to operating out of around 70 prisons and hundreds of community locations from a kind of through the gate service. We also have children and family services, so we run 19 children's homes and have a number of fostering and adoption contracts with local authorities. We have Shore Education Trust and some smaller education organisations like Optimus and Gabatas. So education is a big part of what we do. We also have community charitable social enterprises, so we have around 50 retail shops. They obviously help us to gain revenue for the organisation, but also to support some of our customers who want experience in that kind of setup. We also have a learning and skills division. So we run apprenticeship programmes, foundation learning, and a whole range of other levy and non-levy learning opportunities. Within the Shore Trust Group now we have Prospects, who joined the group around a year ago, just over a year ago, Ixion Holdings, Shore Education Trust, and there are a number of other smaller organisations within that larger group. So the Disabled Living Foundation, the Age Employment Network, Fourth Sector, which is one of our social enterprises up in Scotland, and a whole range of other smaller organisations that together have a purpose of transforming 1 million lives a year. And that's really difficult for us to quantify because of the wide sphere in which we operate. So we're working on that at the moment. I would say at the moment we gain around 50,000 hard outcomes a year, and that's based on what our commissioners, a whole range of different commissioners, expect from us contractually. But in terms of how many lives we can actually touch and positively transform, that has yet to be clearly quantified. So work and health programme. I started, as I said, about 2012 with Shore Trust, and I've headed up all of our national employment programmes since that time. So work programme in 8 different CPAs, work choice in 20 CPAs. And what I found through all of that, as previous iterations of employability as well, so work step, work prep, FND, New Deal, Employment Zone, all of the programmes that have run since the beginning of government outsourced provision, they all lacked one critical thing, and that was joining up all of the other support elements that an individual accessing those programs is probably accessing elsewhere as well. And I'll tell you a little story that kind of framed that for me. So Scott alluded earlier to a pilot that we did in East London in our work programme Prime about 4 years ago. And we had about 25 offices across London, and they were all much of a muchness. You remember the old kind of standard welfare to work offices, a couple of training rooms, a computer suite, and as you say, you know, a load of advisors really sat waiting for people to come through the door, and some people sat there reading the latest copy of the newspaper and all of that. And it wasn't particularly inviting. It certainly wasn't a particularly vibrant space for people to come and access services. So we turned 2 of those offices, Hackney and Lewisham, into what we call community hubs. And we opened them up to the public. So you didn't have to be on our programmes to access the services. We had money advice services in there, Job Centre Plus were co-located, local GPs and health services were co-located, along with a whole range of other support organisations. And the idea behind that was that we wanted to create a space where customers wanted to come and staff wanted to work. And so drinks were free, fruit was free, all of the kind of the nice fluffy stuff, but also more importantly, access to services all under one roof, and access to a range of health and wellbeing services as well. So that kind of sets the scene. I was in our Hackney hub and I was talking to a customer, well, a group of customers at a focus group, and I asked them what their experience of the welfare state was generally. And one customer gave me an example, which is really the basis of where we are now, I think, in terms of work and health programme. The example was this. He'd been asked to attend a meeting with his housing officer, his probation officer, and his job centre contact on the same day within, you know, a few minutes of each other, and had to make the decision, you know, do I go back in prison, do I lose my accommodation, or do my benefits get stopped? And I said, well, why didn't you just say to them that that was an issue? Oh, they don't speak to each other. You know, that they're refusing to, this one's telling me I have got to attend, this one's telling me I've got to attend. And it kind of got me thinking, as a sector, we are not that great at communicating with other parts of our sector, and, you know, the wider support services sector. So this is why I'm really excited about Work and Health Programme, because for the first time, the Commissioner has almost forced providers to ensure that there is joined up local service integration. And so you can see there from the map where we deliver Work and Health Programmes. So Central England there in the blue. I'm not quite sure who in the department got the A star in geography, but never mind. So Central England in the blue, up as far as kind of Lincolnshire, down as far as Beds and Bucks. And then the home counties, again, brilliant. East of England has always been firmly in the home counties, down to Kent and Sussex. And then we've got a contract there in West London as well, across the 7 West London boroughs. So to talk about localism and service integration, where you're delivering over such a massive area in a completely different way than we've ever delivered services before, it's been a real challenge. And so I wanted to share with you tonight some of the successes that we've had, some of the challenges as well, but some of the successes we've had in overcoming some of those barriers to real, true, joined up service integration at a local level. So this programme is different. A lot of people have said, well, it's another iteration of work programme, or it's a mishmash of work programme and work choice. It totally isn't. There may well be some of the familiar faces on the programme because, you know, we've all been there, we've all seen people come through the system. I remember people coming into my office when I was on New Deal back in 2004, 2005, and they have a folder full of certificates. They've got the forklift licences, they've got their diplomas in this and their cards in that. But actually, you know, they'd still never done any actual work because New Deal very often didn't encourage people, you could say, to actually go into work. Work and Health Programme is all about finding something meaningful that the participant really feels is going to make a difference in their life. So when we start a customer on their journey, we're not just going to look at how employable they are, because actually that doesn't really matter if some of these other aspects of their life aren't where they need to be. So we'll look at their social and their support networks. We'll look at their housing situation, which is very often a barrier to employment. We'll look at their disability or their general health and well-being, their life skills, the experience that they've got, not necessarily work experience, but life experience, their financial situation, which is obviously a massive barrier to people finding and securing work. And we look at their family and their personal responsibilities. And then when we've assessed all of that, we'll then look at preparing and finding work. So the delivery model is, our delivery model is really different. Everything centres around a one-to-one relationship with what we call a support manager. And Scott mentioned earlier, we've chosen that title really carefully because we don't consider our support managers to be advisors. Yes, there's an element of advice and guidance in their role, but it's much wider than that. And so the participant will have that support from their SM from the time that they're referred to us from Job Centre Plus, right the way through to starting work, sustaining work and beyond, and accessing all of the in-work support as well. So that could be support to gain a qualification, accredited qualification or a short course, or it could be in-work progression to a job that better suits their needs, or even just an increase in hours. I'll talk a bit more about integration with local services in a moment, but what we've tried to do is ensure that there are a number of internal support options for customers. So we have our Tools for Success. This is an online portal, Sure Online, so customers can access all of the tools that they need. We have specialist support for employers. Now, employer engagement, and Jenny, who's with us today, who's our National Employer Manager, you'll remember Jenny from previous contracts. Employer engagement has always been generally about generating vacancies, generating opportunities. And we wanted to move away from that. Yes, it's important, but actually it goes wider. So we've put together inclusive employment teams that work with employers to get them disability confident, to help them understand what their responsibilities are, to help them access things like access to work, access other support in the workplace like qualifications, and unpick some of the issues around levy, non-levy. We have a network of expert volunteers. This is something that we started back in the days of Careers Development Group. That's grown quite substantially now. I think we have around 1,200 volunteers, and in the last 12 months they've given 170,000 hours of their time to support our customers across a range of different programmes. And our volunteers come to us from all walks of life. We've got ex-CEOs that have retired and they want to give something back. We've got lots of employers that volunteer to run day in the life of sessions or mock interviews or a range of other support. Wanted to talk about our health and wellbeing team as well, and Katrona, my colleague, is going to give you a bit more information on this, particularly around reflective practice. Our health and wellbeing team are expert clinicians who are there to support the support managers. They come from a range of backgrounds: general practitioner, expert in musculoskeletal. There's a whole load of different skills and experience there, but they know how to have those conversations with the GP or with the IAPT team locally. They know the right language to speak, which our support managers won't. And so we can help our customers to access the services that actually they're entitled to by making sure that we have that kind of expertise around what services the customer requires. And one thing I really wanted to mention, because this is really helping us with the whole service integration piece, is time credits. So, excuse me, time banking is nothing new, started in the 1980s, but we've gone a step further and are partnering with an organisation called Tempo. And for every hour that one of our customers volunteers to help their community, and that could be absolutely anything from running a reading group in the local library, taking part in a local walking group, litter picking down the canal, absolutely anything at all. For every hour that they do that, they receive an hour's time credit, and they can spend that time credit on a whole range of different activities. So an hour's swimming in the local swimming baths, an hour's gym. They could save the credits up and go down to London in the school holidays and take the kids to the Tower of London or to Madame Tussauds. So it's really all about giving something back and recognising that by helping and supporting the local community, actually they're getting that recognition. Similar to your kind of, the whole idea of going to work and getting something back for that. There's no issue with people's benefits, there's no cash value to these, but we've found that people who are engaged in this are really, really starting to not just make a difference and feel that they're making a difference, but the feedback has been phenomenal. So I'll give you a little example of that. In our Leicester hub, similar to this one, but in Leicester city centre. We had a customer, Nina, who, as a hobby, does looming. Now, I'm trying to use my hands, I can't really explain what that is. Some kind of knitting type thing from what I've seen. And Nina was feeling down and feeling, like she hadn't got many friends, that she didn't have a support network. And so we spoke to Nina about maybe running a volunteer, group. And so she started running these sessions for us called Knit and Natter, where we'd get customers involved who wanted to be involved, and they'd come into the hub and they'd knit premature baby hats, which were then given to Leicester Royal Infirmary for the premature baby unit. So that was great to be able to give that back to the local community, but actually all of the people that started in that Knit and Natter session, their confidence improved, their self-esteem improved, and I think about 90% of them now are in work. So, it just goes to show that kind of volunteering and the added bonus of the time credits really does make a big difference. The main thing, though, about the Work and Health programme is, as I say, the social value and the integration with local services. We've gone out and spoken to probably getting on to 70 MPs now about, what we can do to join up services within their constituency. We've done presentations to the chief execs of about 30 different local authorities across the areas that we operate, and that in itself gives us more of an inroad into the service integration. So speaking to directors of public health, for example, has led to us being able to access a number of services in Kent for free for our customers, and also in terms of outreach, we're now able to access all of the public libraries in Kent and use all of their IT facilities for job clubs and qualification attainment with no charge at all. So, there's lots of logos on there. There are thousands more. What I would say is that it's really the support managers knowing their local area and owning that service integration locally that's made a big difference, because this contract is phenomenally complex to deliver in terms of logistics and geography. We have 5 of these work and wellbeing hubs, like here in Birmingham today. We've got one in Leicester, one in Tunbridge in Kent, one in Acton in West London, and another one in Norwich. But the majority of this contract is delivered through outreach and co-location. So we're co-located now with around 500 different organisations, everything from children's centres, community centres, health centres, outreach centres. And we also deliver from over 1,000 outreach locations. That could be a local library, it could be a local Costa Coffee, but it's all about delivering services in the heart of a local community where the customer feels comfortable and critically where we can access all of those other support services. And the best example of that I can give you is when we were setting up the contract in Birmingham, we had an agreement to deliver services in South Birmingham on an outreach basis. And that was all well and good. It was a suitable room, about the size of this room. We could have a printer in there, we could have space to see customers, but it was just us delivering. And so one of our support managers got in touch with an organisation in Northfield in South Birmingham called Northfield Community Partnership, and they have loads of other services running from there. So they've got food banks running from there. They have a support group for victims of domestic abuse. They have a needle exchange service. They have about 20 different support items running from that location. And so we decided to co-locate there so that our customers could get involved in all of that other support. So I think, to summarise, the really important part of service integration is around the opportunities that it creates for us. So opportunities to work with IEP teams, with local authorities, NHS. We're now talking about joint commissioning with combined authorities, CCGs, sharing resources. So we'll go in with a model where we'll fund a percentage of a contract that's delivered by NHS, and in return they'll give us access to a load of other support services, and really aligning all of that service delivery ultimately to build capacity with the smaller providers that we have on our various supply chains, and also to make sure that the customer remains at the heart of all of the delivery that we do.